The ability to identify products to the batch or serial number using GS1 standards facilitates more efficient, accurate and targeted recalls. Once an issue is identified, the local health authority is notified. If the recall is not manufacturer-driven, the healthcare authority contacts the manufacturer based on the device barcode to request more information. Following an investigation, the manufacturer provides the health authority with additional information, again using the barcode to identify the products. The healthcare authority then advises all relevant stakeholders of the required corrective measures, timeframe for action, and list of products that are impacted. This means that any stakeholder can check the recall notice, quickly identify if stock is present in their facility, then scan the barcodes on that stock to confirm the correct item is removed. If required, caregivers can determine the patients who received the impacted device and contact them. The healthcare providers can identify the patients affected by the device by accessing data stored in the electronic clinical record and in the relevant regulatory database.